Hi everyone, my name is Sierra.
I am Jackie.
And I am Geanice.
And this is our presentation on the link between periodontal disease and cardiovascular disease. Periodontal disease and cardiovascular disease are both prevalent diseases in the United States and even worldwide. A key focus in our research is the association of periodontal disease and cardiovascular disease, and how the presence of periodontal disease can increase the risk of developing a cardiovascular disease or experiencing a cardiovascular event. It is important to educate patients and the public of the link between oral health and systemic diseases. Part of the education process is promoting ways to prevent oral and systemic diseases. Through our research, we cover the etiology of periodontal disease, the association between periodontal disease and cardiovascular disease, treatment and preventative options, and effects of socioeconomic status and age on disease development. Our research objectives included ultimately trying to determine if patients with periodontal disease that are higher risk of developing cardiovascular disease than individuals without periodontal disease. We also want to identify and compare the etiology of periodontal disease and cardiovascular disease, and provide a foundation of knowledge to better educate patients on the risk and management of disease.
For our research methods, we analyzed 4 systemic reviews and meta-analysis of randomized controlled trials using the PRISMA and CONSORT appraisal tools. One study included longitudinal cohort studies examining the risk of cardiovascular disease in individuals with periodontal disease compared to non-periodontal populations. There was also a study that included 12 patients with cardiovascular disease who participated in a non-experimental face-to-face interview. The data was analyzed using thematic analysis. Another study of 18 participants with moderate to severe periodontitis and OCAA had subgingival biofilm and coronary balloon samples collected and analyzed. For our research results, even though the participants stated oral health was relevant, the majority of them had poor oral health, especially the patients from low socioeconomic background. Also, the majority of the participants were unaware of the connection between poor oral health and cardiovascular disease. A study that focused on immigrants and ethnic minority populations found that individuals lacking social support systems were more likely to experience oral problems, dental caries, and periodontal disease. Men and individuals with severe periodontal disease are at a higher risk for developing cardiovascular disease than women and those with mild periodontitis. Findings suggest that patients with periodontal disease are 1.68 times more likely to develop hypertension.
An article found increased C-reactive protein levels in both the populations with periodontal disease and cardiovascular disease. Another article showed that P. gingivalis, one of the bacteria implicated for progression of periodontal disease, can travel systemically and influence the pathogenesis of other diseases. 17 identical phenotypes were identified in the subgingival erythroma samples and suggest possible translocation between periodontal pockets and coronary arteries. Our research shows that some studies have been inconclusive for a direct link between periodontal disease and cardiovascular disease. A few studies have identified common risk factors such as high reactive protein levels and the spread of P. gingivalis bacteria from the oral cavity to other regions of the body. Though articles do provide a foundation in the understanding of etiologies of periodontal disease and cardiovascular disease, the results varied and did not provide a definitive answer to our PICO question. We also found a gap in patient care between their medical doctor and the dentist or dental hygienist, and the lack of communication between the two. More research studies will need to be conducted. For our viewers watching our presentation, we are curious to know, with the data we have collected, how might you use this research with your patients? And do any of our results or interpretations contradict what you know to be fact? We would love to know more about the correlation of periodontal disease and cardiovascular disease, and welcome all feedback. Here are research references. Thank you.